Have you ever treated someone who says they're needle sensitive, and the moment that you go to needle them, you can just feel them lock up? Their nervous system starts screaming at you and they flinch as soon as you touch them? I use 3 simple techniques to help calm this type of patient down, and I'm going to go over them in today's video. Hi, I'm Maya Suzuki, the founder of ShinKyu University, and I've helped practitioners from around the world bridge their practice between TCM and traditional Japanese medicine simply by teaching them what I was lucky enough to be taught while going to school in Tokyo, Japan at Toyo ShinKyu Senmon Gakko. Now, if you're interested in really bridging your practice, I would love to speak with you. There's a link for a chat in the description box below. Let's talk about your practice, the goals you have for it, and what we can do to get you there. Now, this video is for those practitioners out there that really want to treat needle adverse patients and are really struggling to be able to treat them without causing pain and flinching and all of the other things that go along with it. Now, the first technique that I really recommend is learning how to build a solid palpation. Now, for this demonstration, I'm going to be showing you that on a pillow, just because it's going to be super easy to show you. But I really recommend trying this out on a friend or a loved one, and of course on your own body, and really try to test and see what feels different for you. So let's go into that first palpation technique because it is really, really beneficial and super helpful for your practice. So again, I'm using my pillow here. The reason why I like to have someone use a pillow initially is because it's an inanimate object. And ideally, you want to start all of your practice on inanimate objects and then move to yourself and then friends and family and then finally the public. So let's talk about first contour. Oftentimes when people go to touch and palpate the skin, they're pushing in to their patient's body and they're really trying to push and find a specific place. Notice that I'm doing this with one, sometimes a few fingers, oftentimes maybe with the middle finger, and they're just constantly pushing and pressing. Now, it's really important to understand that palpation is not a massage technique. I'm going to say that one more time. Palpation is not massage. And for that reason, we want to make sure that our palpation has a very soft and gentle touch. And we want to make sure that our hand contours to the body. So that means rather than having your hand here, or here, or here, or even here, as you can see my pinky side very tight and raised, instead we want to have a nice relaxed hand with as much touch as we can from the entire hand. Now there are some exceptions to this rule. For example, if I'm going to palpate someone's face, I'm not going to put my whole hand on their face. That's a little weird. Instead, I will float my hand a little bit, but notice how my hand is always trying to contour to the face unless I can't, and then I might move my other fingers out of the way. So make sure your whole hand is touching all the time, and especially on a pillow, it's really easy to see. You only want to use the weight of your hand, so you should barely, if any, depress this pillow at all. Now, it's really easy, of course, to practice this on a really soft pillow. Mine is actually quite firm. The firmer the pillow, the harder it is to see your weight. Now, the second technique that I like to teach all of my students, both those who I teach at CCMU, the acupuncture school here that's local to me, or within ShinKyu University, is to make sure that they have a guide hand. Now, a guide hand is really important, especially for sensitive clients that jump every single time you touch them. Also, patients who have been through domestic, sexual, or physical violence will feel the same way and react the same way. So it's really important. So let's say that this pillow is my patient's body. I always want to make sure that before I touch their abdomen, for example, I'm going to tell them, hey, I'm going to touch your abdomen. And then I'm going to put a hand usually on their arm and then on their side, right? And then I'm going to put a hand on their belly. So I'm going to take steps with my hands before I finally get to their stomach. If you touch their stomach right away, especially again with that heavy palpation or what I call creepy palpation, where your hand is kind of floating or really tight, then it's going to be a huge shock to your client and they are going to jump. This is very true, especially for people who what I call are overly sensitive, meaning as soon as you touch the tissue, it jumps because it's ticklish because there's so much tightness or excess underneath. So the last and final thing that you want to do in order to really truly treat a sensitive client is to use what we call in Japanese medicine your oshide. Now your oshide is the beneficial non-dominant hand. Now for me, my non-dominant hand is going to be my left hand because I am a right-handed person. If you are a left-handed person, then it'll be your right hand. And you're going to find a point with your left hand. Of course, you see full palpation, always touching the sides before I touch the belly. Full palpation. As soon as I find a point, I leave my hand here. This is really nice because if you're bringing your other hand here with the needle, it doesn't just have a needle dropping onto the stomach. You have a hand touching, finding a point, then the needle touching. And it's really, really beneficial for those, again, who are really sensitive, for those who've gone through physical or abusive trauma of any kind, because their body can sense when you're about to do something, and it can sense at all times where you are on the body. So there's actually a lot of other things that you can do to really help a sensitive client's body relax and calm down. Techniques like contact needling, scatter needling, of course, Shonishin techniques are extremely beneficial in helping the skin to relax, allowing the wei qi to disperse for whatever reason that's happening for them. Now, I'm not going to cover all of those in this video, but if those sound like interesting things that you also want to learn, then you're going to want to have a chat with me, and let's see if mentorship inside ShinKyu University is a good fit for you and your practice. There's a link for that in the description box below. Now, I would love to know if you use any of these techniques in your practice currently. Let me know in the comments below. All right, everyone, that is it for today's video. Thank you so much for watching. I always appreciate your time, energy, and effort because it is extremely important that not only you put that into your practice, but it's a huge compliment that you spend it with me. Now, don't forget to like and subscribe, hit that little bell to be notified of future videos coming out all about traditional Japanese medicine. And if you would like to learn more about your needle technique, then you're going to want to watch this video right over here.